Hello and welcome to another episode of The Holistic Way. My name is Todd Hart. I'm the host of the show. Today I'm very excited to welcome Dr. Andrew Rainford to the show. Welcome to the show.
Thank you, Todd.
Why don't you introduce yourself and tell us what you do?
Todd, I'm a board-certified chiropractic orthopedist, and I practice in New Hampshire. Been there for 31 years now, and I have a family of 5 with 13 grandkids, and
wow,
we have a great life.
Fantastic. So what does it mean to be a chiropractor? What does that mean?
For me, it means sort of a different approach to looking at the way we deal with health issues. Chiropractic is the largest natural healing art form outside of medicine that exists. And today, people are looking for alternatives to solve their individual health issues. Chiropractic originally, in its infancy, started back in, Greek, Roman, Chinese medicine. It existed then, and it's a hands-on approach to looking at different problems and then applying natural principles to try to solve those problems.
Do you know when the term itself was coined? Do you know the history of it at all?
I believe it was D.D. Palmer, and the Greek, it came from the Greek word chiro, and it was chiro meaning a hands-on thing that was applied with the hands and the practice of using your hands.
What is the education of a chiropractor like? How does it differ from, say, traditional general practitioner or even like a DO? How do you compare to what they're doing in your background and training?
The approach today is much the same. It wouldn't, whether you were DO, MD, DC, podiatrist, dentist, they all look pretty much the same. They have an undergraduate program that you have to qualify for, and that's either a rigorous 2-year program or 4-year program in a college setting where you take an upper-level organic chemistries, upper-level sciences, life sciences, and then you'd enter into a curriculum where you'd go to chiropractic school. You'd have graduated from college, enter into chiropractic school, and that's either a 4 or 5-year program depending on what college you choose. The amount of hours is around 4,800 to 5,000 for a DC, and the medical doctors are about 4,650, and wow. I think the DO is around the same. PT is a doctor of PT right now, is an upper level PT that's trying to do very much the same thing in the curriculum, and they're around 3,800 hours, and we're just a little bit more because we're kind of steeped in physiology, anatomy, and biomechanics, because the way we're sort of put together and the way we run has a lot to do with how we work. So just a simple thing, if you stepped on a tack, you change the way you would work, and it's just a simple little pinpoint entrance into the your heel or your toe, but the ramifications of how that changes the body are huge. So in essence, are you looking for the tack all day long? You're looking for a way to eliminate what it is that's made that change in the system. Mm-hmm. So,
is there I know traditional medicine, they go to a residency program. Do you have that sort of thing as well that you have to do a residency?
It's not as long. We have when I went to school, it was first you started in on your peers. Mm-hmm. And then you went to the families of those peers, and then you went to the public.
Right.
So over a course of a year and a half, you matriculated and you got, more proficiency. You were let out into the public to do your work.
Nice. Something that always comes up with chiropractic, at least it used to years ago, is it safe? Do you still face that today? Do people ask, is it safe, and what do you respond to them?
Well, anytime somebody's in pain, if I had a painful joint and I'm trying to make it move better, it doesn't make sense sometimes that if I try to move it, is it going to make it feel better when it hurts to move it?
Right.
So that type of logic comes into the clinic on a regular basis, and we have to deal with that. But if you're looking for the safety or efficacy of it, it's 400 times safer than the use of aspirin. Okay. Today we lose about 15,000 people a year just from aspirin alone entering an emergency room, and it's particularly worse over 60. So as the elderly population looks for something as a painkiller, it gets to be more and more challenging to find something that works for them that doesn't harm them at the same time.
Is that worldwide, or is that in the United States?
That's in the United States.
15,000?
15,000.
And no one ever thinks about taking an aspirin. They just pop it in their mouth and don't have a second thought.
In fact, your cardiologist would probably recommend that to most anybody.
Yeah, yeah, fascinating. So, you mentioned at the beginning that you were chiropractic orthopedist. What is that? How does that differentiate from just saying you're a chiropractor? Is there something added to your training?
In every healthcare discipline, there are upper-level accreditations that you can take. So, for instance, in medicine, we're familiar with you can graduate from medical school, and then you decide, I want to be an internist, I want to be a gynecologist, I want to be a dermatologist, I want to be an orthopedic surgeon. Well, the same thing exists in chiropractic. Same thing exists in dentistry. In chiropractic, you can get internal medicine certified. You can get certifications in sports, orthopedics, radiology. So it's just an advanced degree in the same discipline, basically in another 300, 400 hours of quality sit time,
right,
to have that a few extra letters behind your name.
So who is a primary patient that you would see? What are they dealing with? What are their issues?
Actually, anybody that wants to solve a health issue naturally would be a client. If it's something that belongs in the clinic, which is the first thing we have to decide, that's my number one question: is does it belong here in the first place? The next question is establishing what it is that we're looking at. Where is it? What's producing the pain? Is it coming from inside the body? Is it an external source? Is it a ligament, a bone, a tissue, a joint surface, muscle tissue? Those are the things you're running through your mind. And if I can figure that out, then the last question I ask myself is, what precipitating factors are holding this patient back from getting better? And sometimes up front, you need to address those right away. The guy's not sleeping. He's driving around his truck all day. He happens to be a delivery man, and I'm trying to fix his back. If I don't talk to him about those other issues, the precipitating factors, the length of time for treatment increases. So the sooner you get down to answering those three questions, the quicker you get a resolution.
So when I think chiropractor, I always think back, neck, some sort of back pain, some sort of ache, but you're saying people would come to you for maybe a skin issue or migraine headaches, or...
They certainly could. If we were diverse and working with internal related issues, functional medicine is a big part of many chiropractic practices and even medical practices now. And functional medicine is really looking back at the function of the body and making changes within the internal structure of the system, rather than, you typically have chiropractic working on the outside of the body and making those changes. Now we're addressing, not only does the individual have a back problem, but it's degenerative joint disease, but he also has degenerative joint disease of his knee. And by the way, his fingers are degenerating very quickly. Well, that's usually an underlying gut issue that if you address that, or a mineral deficiency, or low HCl, there's a lot of issues that occur. And if you can ferret those things out, then not only do you stop the back problem that he had, but you begin to arrest or slow down the progression of whatever other disease entity that's going on.
So do you get into diet choices and quit smoking? Maybe you should cut back on drinking. Do you have those conversations with patients?
Absolutely. Lifestyle modification is a huge part of the practice.
Do they fight you on it?
Oh, absolutely. But I say it's your body. You're the steward.
Right.
You got one shot at this.
So in my experience years ago, I had a motorcycle accident. I went to a chiropractor, and it seemed like, at least with the person I was seeing, this is 25 years ago, they always wanted you to come back every week. Is that something that is that normal for a chiropractor, or is it just maybe I had an underlying condition? Is it something like, how long does treatment usually last if someone's having a back problem or a neck problem? Is it an ongoing patient?
Well, let me just give you the evidence-based material that's out there, and the evidence supports that's in the scientific literature today that chiropractic is actually twice as fast as medical care. It's half as costly. So when somebody comes back again and again, I don't know what the exact philosophy is of that particular doctor.
Sure.
But I can speak for myself that our philosophy in the clinic is we want to help you with your problem, make you as independently as possible. And if from time to time we need to tweak something to help you live better, a better quality of life, it's understandable that we'll need to address it by either ongoing manipulation, ongoing exercise, showing you stretches, showing you, some people buy inversion tables. Some people, we show them how to use foam rollers. We show them how to use balls, tennis balls, all sorts of modalities that will mimic a quasi trip to the chiropractor.
Sure.
That will help you deal with the ongoing issue. If you've disrupted the tissue enough to cause something to be unstable, from time to time you're going to get in trouble. And the bottom line is that could you return to the chiropractor to stay healthy and out of pain? I mean, if the goal was to stay out of pain, then if that's the only modality that's available and that's the only thing that works, then I would say definitely come back in.
Okay.
I mean, to give you a quick story, have a lady with a 30-year problem. She had surgery. They put instrumentation. They put steel on one side of her low back, and she had chronic right low back pain as a result of the surgery that has never left her. Now, I took that pain away, and I said, I need you to go. And she was so happy to stay because she had never had any relief for 30 years.
Wow.
That she came back after 4 months. She says, I don't know if I can do this. I don't know if I can stay away because I don't feel as good doing all the things you taught me as I do when I come in and get pulled and adjusted and tweaked. And so I says, okay, well, maybe this is one of those that need to come periodically.
It would make sense, yeah. So we're almost out of time, so stay with us when we come back. Dr. Andrew and I are going to do some hands-on.
Sure.
Is it more of an assessment you're doing on me at that point, or are you?
We'll do a brief assessment so you get an idea what we do to how we're going to look at the body, and then we'll actually put you down and do a couple of procedures.
So it'll be like I'm a patient coming in to see you, and what a patient would go through.
Yeah, that'd
perfect.
be great.
Stay with us. We'll be right back. Welcome back. I'm Todd Hart. This is The Holistic Way. I'm joined by Dr. Andy Ranford, and we're going to go through an assessment of what somebody would go through if they came into your practice. At the break, you were mentioning NFL teams. This is football season now, coming up on the Super Bowl, and you said every team has a chiropractor.
All 32 teams, yeah.
Wow, and they're very busy.
Exactly.
That's pretty cool. I didn't know that, so that's pretty exciting. So should I sit, stand? You tell me what I should be doing.
Stand up for her.
Okay.
So if we think of chiropractic from one standpoint, and that is from a structural standpoint, we're going to make an assessment, like a mechanic looking at a car, trying to figure out where the problems are. If we have an insult to the body, you've been skiing and you've fallen, you may say that you have pain in one particular area, but the location of the dysfunction may be in a completely different area. So looking for functional discrepancies is the hallmark of a decent chiropractic physician. And when you find one that knows how to do this, it could be very, very valuable for your problems. So whether they're acute or chronic, we try to eliminate the functional problems that arise. And the sooner you can establish normalcy after an injury, the better off you are, no matter how you do it, okay? So right now we're working with an asymptomatic patient. He doesn't have any pain, but we're going to go look at him and see if there's some sort of dysfunctional pattern or something that might enable him to work even better than he is currently. So if your goal is just to have no pain, that's great. But if I had no pain, but I walked with a terrible limp and I was to the side like this, eventually I'll have pain. So my goal is to have great function, not just a lack of pain. And that should be all of our goals as we try to elongate our lives. And if you're making corrective changes in your diet, you want to have a great working system, not only healthy from the inside, but working from the outside. So if I ask Todd to just bend over and touch his toes, if an individual cannot do this, there's something wrong, okay? There's something stiff here. There's hamstring stiffness, calf stiffness. Something's not right. If he stands up and bends backwards, and he should be able to arch backwards, he should be able to arch backwards with no pain. If he was stopped and he couldn't bend backwards, there's something stiff on the front side of him. Now, to the left, lean left. Looks good. To the right, not too bad. So he looks pretty good from side to side. But if you couldn't do that, there's something incorrect. So if you're watching this show and you see that you can't do these simple tasks, you're not working as well as you could, whether you have pain or not. So if we ask him to sit down and we just turn his head to the right and he goes this far and head to the left and goes this far. He moves a little better going this way than this way. So is that something that's holding him up in the neck, or is that something on the neck that's bothering him? And if I just touch right here, it's very tight. And if I ask him his occupation, does he spend his day digging a ditch or sitting behind a computer or sitting?
Yep, sitting behind a computer.
Okay, then it's here. If he's digging in a ditch, we're probably looking at sore back muscles, glute muscles, okay? You're working your body. You're trying to work it for your entire life. And the idea is there anything wrong? So if you lean laterally to the left, to the right, and depending on how that is a little stiff both ways. He's not in any pain, but it's stiffer than it needs to be. So our recommendation would be to do some stretching here. Okay? He's probably very strong, but isolate the neck muscles and stretch them would be one of our goals. If you can lay down on your back first.
Sure.
So we assessed him standing, assessed him sitting, okay? And of course, in a full exam, we would look at the shoulders, how they articulate with the shoulder joint, and how that affects the cervical spine. We're doing a cursory exam. If we look at range of motion again, when he's laying down, this should come up to 90 degrees. And if it doesn't, there's too much tightness in the back of this leg, and it should be changed. If you happen to be a dock worker and you're trying to lean over and grab a package and pick it up, and you can't lengthen these muscles, well, guess what? Your back's going to have to work a lot harder. Is that something you want to? Is that something you want to have? To do? I would guess not. Internal and external rotation of the hip joint. So if I turn this out, it should have about 35 degrees of external rotation, and in this case, you probably got 15 degrees, a little tighter. So again, he's asymptomatic, right? So this one, I know it's hard for you to see this,
wow.
If you could look straight down, but Todd can tell you that this one moves much easier. So just in our little assessment, he flexes fine, but there's something cooking right over here on this side of him, okay? Now, because chiropractic is not only worried about the structure, we're worried about how the impact of the nervous system, which comes down from the brain, impacts the body. So I might look at the strength of the muscles down here. So if I ask you to pull your toes up, push them down, push them out, push them in, and quickly you can assess to see how the nerve flow is coming down. He's got good nerve control down there, good strength, good positive muscle contraction. So flip over, Todd, onto your tummy.
Sure.
Now, if I pick this leg up this way, this heel should touch the butt without too much difficulty, okay? And if I add a little bit, it's not too bad. I like to see that in everybody, and this should extend 6 to 10 inches off the table, and he does a really good job at that. Again, when this is tight, and it's usually tight with people that sit a lot. And if you made this little assessment for yourself in the evening, your husband and wife, you're looking at this right now, and you say, honey, I want to check to see how your muscles in the front of your leg are, and you did this, and it doesn't go down, you need to stretch this front. This will precipitate knee problems, okay? It will precipitate hip problems, gait issues, low back issues. Again, we look at the internal and external rotation of the hip joint. When I'm in this position, what happens to this hip is less external rotation, or in this case, it's internal rotation of the thigh. And in this case, these muscles here are tighter than they need to be. So if we're trying to fine-tune him, and this is an individual who runs every Sunday and catches for the Patriots. This is an individual who's working for the Red Sox. This is a young boy that's trying to, be a sprinter, a triple jump person. These are key issues that we want to make sure that they work really, really well so that the efficiency of the body helps him achieve his goal and keeps him from getting injured. So will this produce an injury down the road? Maybe, maybe not. But it's certainly possible. And if I was looking at the system and I found little discrepancies, I change these things. Now this doesn't need an osseous adjustment, a bony adjustment, but it needs a physical manual adjustment and a stretching technique and a strengthening technique to be applied. Do you have a question, Todd?
Yeah, so what would you recommend for that?
External rotation stretching. I'd recommend using a tennis ball or a foam roller on this area. A specific stretch for glutes that we could, that we would show the patients how to do.
Okay.
Okay. Next, just a palpatory assessment of how the spine moves. This is just a simple spring test. If you just spring down the spine like this, it should have a nice, what we call bogey or pleasant, springy feel to it. And what will happen is if you go down and as you're getting down, it's springing, it's springing, it's springing, and then you get to a point and it's stiff. And at that stiffness, I'd ask the patient, does that hurt? Yes or no? And he'd say, well, in Todd's case, it doesn't hurt. Can you feel the difference?
But I can feel the difference, though.
Okay. So here and here. Well, he spends his day behind the computer, right? So we'd expect this to be very, very stiff because this has to anchor all of the muscles that are holding this head up all day when he's doing his typing. So this is working hard, this is working hard, and together, if these were working a little bit better, then you're going to offset the opportunities for issues to start in those areas. Okay? And keep in mind that Todd's method of maintenance is yoga. So what is yoga? Yoga is this self-fulfilling movement pattern designed to open up joint systems, lengthen muscle groups, all designed to recorrect on a self-medicating basis the whole system. Only it's not able to do this and it's not able to do this effectively.
Right.
Because it's more of an intrinsic issue. It's more of something that needs to be changed in a different way. Does that make sense?
It does. So how would you treat that?
Through spinal manipulation.
Okay.
We'd actually make these joints move. For instance, I would lay you on this side, but you can't very well do that.
Okay.
And we would actually lay you on your side and just make an adjustive force through that area. We could use different types of manual tools that we have. They're actually adjusting tools that would percuss the area. And in the process of percussing, it loosens the joint up so that it moves. You get that feel back. And in order for a joint to be healthy, it has to be able to lubricate itself. And it does that through movement. And if it can't move, it slowly shuts itself down. And that shutdown creates the disabilities that we have today, the degenerative joint diseases, the issues of pain that people are suffering from. If I ask you to turn your head to the right, okay, now turn your head to the left. Is one side more comfortable than the other?
Going to the left.
Okay, so we said when we started up in this position that we had a problem on the right-hand side. So he was comfortable turning to the left, but he wasn't as comfortable turning to the right. Now, if you turn to the right, Well, guess what muscles have to let go and stretch here? These on this side. So this is the area that we would suggest that he work, okay, or that we physically work, so that he can improve this area of the body.
Right.
Okay. So does that make sense, Todd?
Yeah, it does.
Kind of what we're up and about. So stand up.
And you mentioned also that you're doing some complementary things as well. So what does that encompass?
Well, the classic things that are complementary to this would be, the home care recommendations for stretching. Any type of stretching, any type of strengthening, rehabilitative that you can think of happens in the clinic.
Okay.
We've been doing that for the last 25 years. We used to have a big facility. Now we got down to just nuts and bolts and small low-tech stuff that people can put in their cars and go home with. And we're finding those work just as well as the big pieces of equipment. But in addition to that, looking at their diet, looking at lifestyle. We've recently in the last year explored the use of essential oils in the clinic. Okay. Essential oils, for instance, here's an example. For a chronic Achilles tendonitis, I use some lemongrass. Sold it to the patient takes it home, they put lemongrass on it on a regular basis. It's been known to be very helpful as far as inflammation and tendon repair, and as a result, the guy comes back 2 weeks later, boom, stronger, feels better. So in addition to that, there are soft tissue procedures that we utilize in the clinic, things like Graston, if people are familiar with those, manual techniques like active release, somatostretching, a variety of neuromuscular treatments. Dry needling is another technique that we use where we'll actually take a trigger-pointed area, an area that's a highly sensitive area, like this, and we'd actually just put a small acupuncture needle within that area, and it's not acupuncture, it's simply using a dry acupuncture needle to perforate the area and displace the pressure that's there, and it has an effect on the neuromuscular junction, and basically it helps us sedate the area and relax it.
I wish we had more time.
I did.
Thank you for joining us. If you have any questions, send an email to theholisticway@hotmail.com. Again, I'm Todd Hart. Thank you so much.
Thank you for letting me join you, Todd.
Thank you for watching. Take care.